One of the major tools we have is using mean gradient. That is a level 1 recommendation for evaluation of the mitral stenosis patient is to use mean gradient. We'll perform this by performing continuous wave Doppler through the mitral valve in a mid-esophageal view, either the mid-esophageal commissural or long axis view. Remember, the mean pressure gradient is better than the peak gradient, as that peak gradient is more influenced by left atrial compliance and LV diastolic function. Report the findings here with the heart rate, as that higher heart rate can increase the mean gradient and overestimate valve severity. And in atrial fibrillation patients, this mean gradient needs to be averaged over 5 cycles to be accurate. In degenerative mitral stenosis patients, mean gradient is a good marker of valve severity, as there's some significant limitations to planimetry and pressure half time in degenerative mitral stenosis patients. Let's look at a few of the factors that it's important to be aware of that can influence the mitral valve mean gradient. The first of which is being aware of a possible double envelope sign. There can be a double envelope artifact, and you need to measure the smaller one here to get a true mean gradient. Some of the ways that you can get rid of this double envelope artifact include shifting your Doppler beam slightly to change it, or turning down the Doppler gain setting to get rid of the artifact that makes that mean gradient look much bigger. There can be technical errors that can occur where your Doppler beam is not properly aligned that can give you inaccurate gradient measurements. Remember, when you measure any gradients, the gradients will always be flow dependent. High flow states, and in this case with associated significant mitral regurgitation or high cardiac output, will increase this gradient artificially. Low flow states, where you have low cardiac output or even obstructive valves like severe aortic stenosis, will lower that gradient, even if valve stenosis is more severe. We'll also take note of LV diastolic function and compliance. Lastly, increased heart rates will cause increased mean gradient measurements.